a couple of things, but yes, when you do this, I mean, really, these things don't tunnel very well, so I made my own tunnels, okay? Because, you gotta be able to do it, and these really don't have tunnel in it. So, alright, so make sure that you check your doctor's orders and make sure what you're doing, what he wants you to do and everything, so that you get your stuff together. So you wanna make sure you have your pad, make sure you have your bag. I'm gonna fix these so they have some lid on it, but make sure you have your irrigation tank, your tape. I'm gonna show you how to get a culture safe. And it may, I don't know, it depends on what the order says, you might have to get one. I don't know, I haven't decided yet. That's what I'm gonna show you how to get one. They do fast.
Living up road.
ABD pads. Now these ABD pads are small, okay? They come in different sizes, so when you're in the hospital setting, get the size you need. But this is what we have. That's what we're working on today, okay?
Somebody went out that door.
The bed to your working height, and you want to make sure that the wound is, of course, where you can get to it, and propped up to a position comfortable for the patient, and so that when you're doing it, because we're going to be irrigating, okay? Now I know last semester y'all learned when you were cleaning them that you went from the inside and you would go out, which is true. Chuck can't get a new one every time, right? All right. Or if it was a straight line, you would. Well, now this is a deep wound, okay? So Miss Ennis irrigates, okay? I don't. You can do the fluffy, this little gauze if you want to. That's a lot of them. So we irrigate, okay? And so wet dressing, base going out there, it's kind of dry with all that stuff, because by the time we get ready to do everything else, it'll be fine. All right. We want it moist for a reason, because what's the moisture going to do?
Promotes
we
wound
go back
healing.
and change it, and we take the thing off. What does it do?
Promotes wound healing.
Yeah, promotes wound healing because we're debriding it, right? Okay. Got that done. I was like you earlier, Ashley, I put too much on this one.
Yeah. Can't get your gloves on.
Now don't do that. You're not supposed to fan. All of that is a no. Okay, but I have too much. I have to do it. Alright. So people sweat. This is the hardest part. I don't know why this is hard for people. Don't make it hard. This has to be sterile, right? It's got your little drape right here. And it's really on the bottom, but everybody puts it on the side. Whatever works for you, okay? We'll leave it on the side. But we can go ahead and get that set up. So put that right there. Okay? And they're like, well, and see, I touched mine from right here. Because only reason I'm using this is to dump my syringe in it, like here. Bam, so I have to touch it. Okay? So if you think, well, I got fat fingers, what Mike's thinking. I got it for you, Mike. Everybody else has got fat fingers, short fingers, and they scared they're gonna touch it. What? You know what you can do? Bam, bam, bam. Well, hey, more ways than one to skin a cat, right? So I got that ready. I'm gonna sit that right there. So that I can touch this, okay? I just can't touch anything else. So I got that set up. I'm ready. All right, I'm going ahead and. You know what, I need to pour some of this out because I done it like that because I got tired of the flipping on it. but then I'm doing too much. So, you know, that will be my lip, and lip it all the way around. Why do we lip it?
You think lower any type of bacteria?
Yeah, we'll get rid of all that bacteria and contamination that we not have on it, because we've used it before, because it's a label. If it's not been used, we don't have to lip it, do we? So we're gonna take it out, we're gonna pour it in there. Put the lid back on it. Then I can put my other stuff in there. I like to set up everything I in before I get sterile. So in saying that, I'm gonna remember my tape this time. Say I am. Nice to have a pair of shoes. Really put this up there. Close enough to live network. You're only gonna need four pieces. I'm gonna tell you like I told the other rips, don't tear 10. If you tear 10, don't be leaving no tape hanging up on my table, okay? That's pet peeve of mine, I don't like that. 20,000 pieces of tape hanging on the table, which I don't use, okay? Cause you only need, here. Okay? So I'll go ahead and open up my little folder thing, cause I said I only gotta get a folder, so I'm gonna up there. I'm gonna get my ADD pads and now these are drain sponges, so don't think I'm crazy. But we don't have a lot of the 4x4s, so I'm gonna use these up before I order more, okay? I don't know who ordered 1,000 drain sponges, because we don't need them, so that's why we're using these, okay? So I gotta order me some stuff, but I'm not gonna order them until I use these up. I don't know if they gave these to me, left this thing there, it's not open. All day. I think it's just me. Now we can take our dressing off. Put our gloves on. So we can take this dressing off. Which way do I want to take it off?
Towards the, towards,
And what's the rationale for that?
so you won't damage anything worse than what it already is.
That's right. No, we don't want to do any damage to our new tissue growth or our new insurance. So. Out some of this. Okay. Then what are we looking for?
Odor. Consistency, odor.
Okay, so when we get that, get a good picture in our mind, and we're ready. Oh, I got my bag open. Put it in our bag, okay? Alright, so we're going at this time, I usually am showing you on that, so I'll show you, but you can go ahead, I'm gonna show you on that, but at this time, you can go ahead and go into the deepest part of the wound and see how deep it is. You know, also if there's any tunneling, but there's no tunneling on here, it's very frustrating, I may just want more tunneling. But it is appropriate to do it here, okay? So, now we done that. We are ready. Well, you wouldn't have it there, you know, you put it right there, because that's sterile. Now we're ready to get sterile. I don't play basketball, can you tell? So if you're going to like measure if you have tunneling, you're gonna do the measuring off here. You don't put those here, you put them on the regular, okay? I just wanted to show y'all that because some people do it that way. I always do it after I clean everything. It doesn't really matter, but I do it after I clean everything. Does that make sense? Whatever you want to do. Alright. Now I'm ready to get my syringe out. And I'm going to put it in here. And I'm going to pull out some of this. I just want to put, oh, what darn, I don't have any Curlex. Dang, it's okay. I said every day, I forget, all day today I forgot something. So, like I said, this was my Curlex, you know. I'm going to put a little bit of this on there because it wants to be wet, right?
It's your what?
Curlex, you know. I'll finish show you in a minute. Okay. You just wait 1 minute. All day long, I'm going to hit one thing, okay? Right here, but it's in a roll.
Okay.
I'm gonna get that wet, right? So I'll come back over, I can put that up there, I'm not gonna touch anything. And so it comes in a roll, you've got that small roll in there, which those are not gonna be big enough for that. But what you wanna do is take it out and you wanna have it fluffy, okay? So when you're taking it out, you're unrolling it from the roll and you're making it kind of fluffy in there. You don't wanna pack it in tight. So why wouldn't you wanna pack it in tight? Huh?
Could it cut off blood flow or air?
Yeah, air and blood flow can't get to the capillaries, which would impede what? Healing, right? But you do want to make sure you feel the whole bed of the wound, right? And you especially want to make sure you pack it in any crevices or creases. And why is that? What could be hiding there that we wouldn't see?
Bacteria?
Bacteria, but we're gonna get that. Did I clean it? I didn't clean it, did I? I got so worried about that. Okay. Necrosis. I got so busy with that. I didn't clean it. I was like, I didn't clean it. So after you do that, then you get you some more.
How much do you want us to draw back?
I just usually like kind of fill this up.
Okay.
So then you want to start at the top, and you want to go from side to side in a zigzag motion. Okay. You want to look for this to be either a light pink or clear. Now some of them may only get to a light pink, and that's okay, especially if they're really, you know, bad wounds, okay? But you want to get it as light as you can. You keep on doing that until you get there, okay? Once you get to that point, then you can, now I'm ready to do this. I got all mixed up in my throat. I'm telling you, I missed one thing or the other today, but
Did you do the culture
I
before you clean it?
forgot I was doing a culture.
But do you do it before?
No, after.
So it don't do anything until the results?
You gotta go in the deepest part, way down, and get a good one. I forgot about the culture. Thank you for learning. Okay, and then put it right here, without touching the bed, because you're still
So irrigate the Curlex, irrigate the wound, culture the wound.
culture, the deepest part of the wound. So for a wound this deep, do you want to use anaerobic or aerobic culture?
Anaerobic.
Okay, anaerobic, and why?
It doesn't need air to grow.
Yeah.
It does not need air to grow, that is correct. Alright. So, you, like I said, for this one, there's big rows of cultures in the hospital. So you wanna make sure you get it in there, not too tight, but in those creases. And then you can come up here and get your little 4x4s, which I didn't pull very many out, because I'm trying to like that. Over, those will be dry, it's wet with the other, and then you take your ABD pad. Here, and at this point, of course, it's covered, the wound is, so you're just being it. Now, the thing about being on the side over here where, you know, the crack is, you know, your rectum, is you gotta be careful not to
Include
put
the
your
butt.
buttocks taped together. And then you gotta make sure you don't put that tape like in the anal part, cause they gotta have a bowel movement, right? So, you gotta do diligent assessment, correct? Right?
Mm-hmm.
Because we know they're gonna have a bowel movement. If they don't have an ostomy or a rectal bag, they're gonna have a bowel movement, and this is absorbent, right? So what do you think's gonna happen? It's gonna get soiled. And if feces gets here,
Contaminated.
it's gonna contaminate. So, I know I'm not a good wound care nurse. I understand. That's why I'm not one. Okay? When I was a medical assistant 100 years ago, I had a patient's son tell me not to. Not to ever do that. It's my profession. I said, don't worry, I won't. I said, this ain't my thing. His mother told him he needed to be quiet, that was ugly, and he shouldn't talk to me that way. And I said, you're telling the truth. I suck. That is my. Okay.
So you possibly may need 5 piece.
Well, that's only because, you know, where I did it. I
I'm
don't
just
put it in
kidding.
the middle. You should only need 4 actually. I said, where did I put that tape on it for there? But anywho, so, put tape on it. Make sure it's all taped down. Then, we're gonna take a small piece of tape and we're gonna put our date, time, and our initials on it. Okay? I know that I'm a terrible person for putting these on, I understand it. But, alright, so if we're looking at tunneling and we wanna know the location of where the wound is, you have to look at and think about, the clock face, okay? So, while we're learning, I got clocks, okay? So, it has to be at the head, okay? So, wherever you're looking at, and like this one has one right there. So, if you're looking, this one, where would you say that this would be on this clock from the
4 o'clock.
4 o'clock, right, about 4 o'clock, alright? So, if you wanna measure it, or you wanna see how deep the tunneling goes, you have to find the deepest part, cause here's one, it goes way down in here. So, you pull it out. Again, I mean, you do this while you have your sterile gloves, cause you dig it all in the space. Right, and then you can come out for here, okay? And then, break that. This is what I do, I just kinda break it off and leave my part, I really need to break it. And, but it's okay, it's all good. And I leave my broken part like here, about where I got my culture, and just chunk that away. And then I measure it later, okay? And then, you wanna measure here.
Head to toe first.
Huh?
Head to toe first.
Yeah, I had to take for one, yeah. I was trying to think of the width, and I was like, what is it? And then, the length, okay? Now, this is millimeters, okay? I remember we had a discussion about this last semester, I wasn't even paying attention to it, and I was like, we have to do it in centimeters, that's what, you know, everything for. That's what you're supposed to do, and then somebody was like, is that centimeters? And I looked at it and I was like, that's not centimeters, it's millimeters. So then this morning, they were like, well, you can convert it, and I'm like, that's not my job, I don't do math anymore, so they did, so there you go, but it's millimeters, but you know, I just want you to know, like, when you do, you know, start it, like you said. Yeah, and make sure you document it, and every institution has a different policy, I mean, depending on, and they have a wound care nurse, but you may be the very first nurse that has to do it. So if you're the very first nurse that has to do it, you have to measure it, and if there's tunneling, you have to tell how deep it is and where the location is. Is it at 3 o'clock, 4 o'clock, 9 o'clock, 12 o'clock, 1 o'clock?
So
Okay.
for checkoffs, are we gonna have that green foam, and you're gonna want to say,
Wait, I just want you to know how to do it. We're not doing that with children.
okay,
But you should know how to do it. So if you have to pack the wound, I'm gonna practice this too. That's why I make these, because there's no tumbling on this. You have to. Let me hear what it is. This one, and you gotta come in, and this is one thing I forgot. You didn't tell me this, Mike. The very first thing you should ask them after you check the orders are they in any pain? Do they need their pain medicine? And if they do, you'd want to give them some pain medication, and after it takes effect, depending on whether the doctor ordered pill or IV, you would come back in and then you would give it to them. Especially if you're packing, because you got to take this here thing, you got to stick it in there. Anyway, you can stick it. Now, you know, I've never been, I can do this, but I don't do it very well. I wouldn't admit it.
That's the worst thing.
Not my thing. And you gotta take this and you gotta keep packing. It's probably because this is styrofoam, but it's okay. And you gotta keep packing this until you can't get any more in, and you leave a little tail out. And then you do the rest of your bandaging. I don't make you do that on checkoffs, but it's nice to know. Some doctors, it depends on their orders, they may order just that this is plain. They can order the one with iodoform on it that has a little medicine in it, or some of them will just do 2 by 2. So it depends on what your order reads. Okay. Any questions?